The question is, the microorganism previously present in the periapical tissues following obturation usually. Okay. So, one of the reasons why we perform root canal therapy is when a patient comes to you with persistent or symptomatic apical periodontitis. What happens is, from the pulpal tissue, if this is your tooth, if this is your tooth, the root, the crown, inside this you have the pulpal tissue, and this area is your periapical tissue. So from the pulpal tissue, the infection spreads all the way into the periapical tissues, and as a result of this, the tooth is elevated from the socket, and whenever the patient bites, there is pain. This is what is called as tenderness to percussion. So what exactly happens is, when such a patient comes to you, you end up performing a root canal treatment. However, when you are performing root canal therapy, you are actually cleaning the entire pulpal system. Your instrument does not go beyond the apex, it does not go to the periradicular tissues, and it is not going to be cleaning up any of the tissues over there. So what exactly happens to the inflammatory exudate or the microorganisms that are present over there? Usually, when you have a patient who is coming to you with periradicular infection, it may be an abscess or it may be just tenderness, periapical inflammation. What is usually advised is, you perform your root canal therapy, you do your cleaning and shaping, and then you place an intracanal medicament within the canal. The intracanal medicament will go all the way, will be act as a nidus to combat the residual microorganisms or inflammatory mediators which are present in the periradicular tissue. In addition to that, the patient, once your entire pulpal system is clean and it is dry, the fluids that are present in the periapical tissues can seep into the canal. So that is why what you do is, when you give an intraradicular or intracanal medicament, this intracanal medicament helps in transmitting or rather combating the inflammatory exudate that has passed away or that has flown from the periradicular tissues into the canal. As a result, the periradicular inflammatory exudate has decreased because it has come into the canal. So this is one of the greatest advantages. This is one of the reasons why you do cleaning and shaping in a patient with symptomatic or asymptomatic apical periodontitis. Okay. Now, after you have done your cleaning and shaping, after you have given the intracanal medicament, and after that, when the patient comes to you, you observe that the canals are dry and the canal is ready to be obturated. So you perform obturation of the entire canal system. However, again, your canal is the only place where your entire GP is going to be present. The termination of your GP is going to be at the termination of your apex. So once your entire canal system has been completely filled with GP and has been completely obturated and packed with gutta percha and sealer, you need to ensure, or you don't know how you're going to be cleaning whatever residual infection is going to be in the periapical tissues. So that is the reason why once you finish your obturation, and if you have a patient who had some form of apical periodontitis, you recall the patient every 1 month for the first week or the first month. You recall the patient after a month, so that you want to assess whether the patient's symptoms and signs have improved. That is, there is no pain and there is no radiographic sign of inflammation. Okay. And if this has occurred, that means you can term that your root canal treatment was a success. Okay. Now, what about those residual bacteria that we were talking about? These residual bacteria are usually easily digested or easily taken away by the host's natural defense mechanism, because the blood supply again to the periradicular tissues increases or rather comes back to normal, and once the blood flow comes back to normal, it brings in your inflammatory cells, and these inflammatory cells combat with your periradicular microorganisms, and they destroy them, engulf them and destroy them. As a result of that, your entire root canal therapy ends up becoming a success. So the answer to the question over here is, are eliminated by the natural defenses of the body, which are your macrophages, monocytes and PMNs.